It's Dr. Clarke, board certified plastic surgeon at Bespoke Aesthetic Plastic Surgery in Rockville, Maryland. And I'm here with Dr. S.
Hi, Dr. S, breast surgical oncologist. So today we wanted to really focus on dispelling some myths. So we wanted to talk to you all about some things that are commonly misconceived or misinterpreted when it comes to breast health. And we wanted to make sure that you got the real information from real doctors.
Absolutely. All right, Dr. S. Our first myth is that you can't get breast cancer without a family history.
That is absolutely a myth. 1 in 8 women get breast cancer. So that means you have a 12.5% lifetime risk of developing breast cancer without a family history. If you have a family history in a first or second degree relative, that increases your risk of getting breast cancer. But without a family history, you already start at a 1 in 8 chance.
Myth number 2. Only older women get breast cancer. Younger women do not have to worry about it.
That is also a myth. Young women do get breast cancer. We see breast cancer in women and men of all ages. Historically, we did see breast cancer in an older group of patients. It tended to be in patients that were in their 50s, 60s, 70s, and beyond. We have better imaging modalities. We are finding breast cancer at earlier and earlier stages. We can determine breast cancer at precancerous stages like in situ disease, and even breast cancer that really is only presenting with calcifications, not even a full mass or a lump on exam. So it's really important to know that breast cancer can happen in women of all ages. Women, unfortunately, in their 20s and 30s can be diagnosed with breast cancer. So if you feel something abnormal, don't just say that you're young and there's no chance that this can be a breast cancer. See your physician and get evaluated, because breast cancer does happen in young patients as well.
Myth number 3. If you don't feel a lump, you don't need to get a mammogram.
That is also a myth. Most breast cancers are actually not palpable. The word palpable means that you can feel it. You can feel a lump, you can see a lump. Most breast cancers are actually diagnosed in early stages, stage 0, 1, or 2, and most breast cancers you cannot feel. Only about 30 to 40% of breast cancers actually present with a lump, which means most you will not feel and need to be diagnosed with a mammogram or other imaging screening modality. It's really important for patients to understand that mammograms for the average age population, so that is the average person without a family history, really needs to start at age 40. On an annual screening mammogram, things like calcifications and small masses that you cannot feel can be identified, and that's how the cancer diagnostic workup would begin. So most masses you cannot feel. So please, just because you don't feel a lump and you're age 40 and above does not mean you don't need a mammogram. Starting at age 40, you need to start doing your annual screening mammograms. Myth number 4, breast cancer surgery makes you look disfigured.
So that is completely false. Breast cancer reconstruction has come a long way in the past 10 to 15 years. What was once in plastic surgery circles considered a truly and exclusively reconstructive surgery, it is now looked at from more of a cosmetic standpoint. So the same standards and the same high expectations we have for our cosmetic patients, we also have that expectation for our reconstructive patients. So incisions are placed in more aesthetically discreet positions whenever it is oncologically appropriate to do so. Nipple sparing mastectomies have become more common, so that you do feel more like yourself after surgery. There are more ancillary procedures that can happen to make your result more fine-tuned, like fat grafting, to really shape and camouflage breast implants that are placed after surgery. So breast reconstruction is now a very beautiful and refined technique, and patients can have beautiful results and feel much like themselves after their surgeries.
Myth number 5. If you have breast cancer, the reconstruction is not covered by insurance.
So that is false. The Women's Health and Cancer Rights Act has made the decree that breast cancer reconstruction after mastectomy should be covered by most group health plans, and most insurers should offer this. So this isn't a global sweeping yes. The majority of plans do cover breast reconstruction. However, it is something that you definitely need to look into and know your rights and know what coverage you have when it comes to breast reconstruction.
Myth number 6. If I don't have breast reconstruction now with my cancer surgery, I can never have it in the future.
So you actually can have breast reconstruction in a delayed fashion. Sometimes it's appropriate to do the reconstruction at the time of the mastectomy. Sometimes your surgical oncologist and your plastic surgeon will decide that it might be better to do it in a delayed fashion after your radiation or your cancer treatments are done. Regardless, you can determine that you want to have a breast reconstruction years down the line if that is your choosing. Some of my patients just have a closure of their mastectomy, and years later they decide, they really do want to have some volume added. They want to have a reconstruction, and it is perfectly feasible to do it at that time. In addition, if you did not have a symmetry procedure at the time of your initial surgery, and now you are, have an asymmetry, the breasts are different size, it is okay to come back in the future to have a symmetry procedure to bring the breasts back to similar sizing. So these options are available to you.
So this October, it's Breast Cancer Awareness Month. So please make sure that you get your annual screening mammogram starting at age 40. If you feel something abnormal, say something to your physician and get it worked up. And please remember, men also get breast cancer.
It's also important to note for all the ladies who are younger than 40 years old, if you feel something, make sure to tell your doctor about it. And if they brush you off because they feel like you're too young, without the appropriate consideration, without the appropriate examination, make sure to advocate for yourself, get a second opinion, see another doctor until you're taken seriously and you feel comfortable with what's happening with your body, okay? And also understand that breast cancer reconstruction is your right. So at the very least, see a plastic surgeon so you can find out what your options are so you're very informed.